Well, it's so interesting because whenever we pick a topic, those people show up in our office. Yeah. It's amazing, Michelle. And yes, I'm really lucky to be here, to be on the Karina and Dr. Tom show. So we're going to rename it, instead of Ask the Expert, it'll be called the Karina and Dr. Tom show. But great to have you back.
Thank you for having me back.
Thank you. And for those who may not know, Karina is our medical assistant and surgical scrub tech and surgical assistant. So she is invaluable to me. She's notice I said our, because she's really part of our team, but she is my Radar O'Reilly. And you've never seen MASH, have you?
No.
Okay. Michelle, do you know MASH?
Oh, yeah. Of course I do.
Okay,
yeah.
you know MASH. Well, okay. So we'll have to maybe get some old shows so Karina can see who Radar O'Reilly was and why I call her that for me. So
right-hand man.
Right-hand person who knows everything before I'm even about to speak it. So that's why we have Karina here. So thank you, everybody, for being here. Michelle had mentioned that we have won 8 years in a row, Press Democrat Best Cosmetic Surgery Office. We were really shocked. We didn't even know about it, but in the Bohemian, right? We got, Karina, we got voted for which counties?
Oh, I think it was, you're tricking me now.
I know,
I don't remember.
Okay, you don't remember, that's okay. Sonoma and Napa, we won Best Cosmetic Surgery, so that's okay. I'm gonna fire Karina after the show, but don't worry about it. She's gone. Anyways, but no, we just got voted for that, so we appreciate everybody. And so today, Karina, we were going to talk about treating the jowls, okay? Yes. Treating the jowls. And so let me just preface that, Karina, because we're going to kind of get into a little bit of a discussion of some of our patients, anonymously, of course. But if we're talking about the jowls, and everybody kind of, looks in the mirror when you get a certain age, you kind of put your hands on the side of your face and you pull up a little bit. I just want that, okay? And unfortunately, for a lot of those patients who come to see us, I have to tell them, we have to always be intellectually honest with our patients and say, what you really need is a facelift, and they don't want to hear that, but we'll say you need a facelift. And if they're willing to listen to us, then we'll go ahead and we'll make a recommendation for them to go on to see one of our colleagues, facial plastic surgeons who do facelifts, okay? But then a lot of them, what's their usual response when we tell them that?
It's either, I don't want that. No, that's not what I was thinking.
That's not what I was thinking.
Yeah, I've been thinking about it. So.
Right. And so then we would, of course, refer them on their way. But most of them, I would say, they're not interested, right? And so what do you think are their concerns, Karina, when our patients come in? You and I were chatting about it as we were driving from the office over here to the KSRO offices. What are the patient's usual complaint when they sit down? Because you bring them in and you're talking to them at first. What do they comment about?
It varies. Usually, I look tired. I look angry. I want to look approachable. Specifically for the jowl area, this is hanging. Or my face is falling off, is what I'll hear. Yeah, so along those lines.
Okay, so you mentioned a couple of things. One of them was an emotional response. Yes. You said, I'm looking tired or I'm looking angry. Okay. Some of that can be around the eyes, and usually if it is the eyes, we're going to recommend some Botox or Dysport for the 11s, the frown between the eyes. Sometimes they're hollowed under their eyes, and I've actually had a recent show on that. Treating that area with filler or easy PRF gel, which is your own PRP activated with your own protein. But that really wasn't going to be the conversation for today. Still, however, the lower part of the face, we're going to talk about the lower third now in terms of the jowls, that area can still emote you being unhappy, right? And part of that, and it's so funny that you would go there, because I think I threw you a little bit. You're going, okay, what is it, that these patients are talking about? You had mentioned that emotional response of I'm looking angry or tired, right? And so we tend to think of the frown area, right? But actually, part of that, or what we call the RBF, or the resting B face, the not happy face, the resting not happy face, is a downturn of the mouth, okay? And so some people just naturally have this downturn in repose, okay? And that can actually be easily treated without fillers and not worrying about the jawline, but that downturn of the mouth, there are two muscles on each side of the corners of your mouth that go from the corner of your mouth down to your jawline, down on the outside of your chin. And those you've heard us call the DAO, okay? And those are the depressor angularis oris. So depressor means it pulls down on the side of your mouth, at the angle, so depressor angularis, oris means the mouth, okay? Those two muscles. So what do we usually recommend for that?
Dysport or Botox.
You got it. All right. Okay, she's rehired, everybody. She got that one right. So absolutely. So these muscles pull down on the side of our mouth, okay? And so what we can do is inject that muscle with a little bit of Botox or Dysport. For those who don't know, Botox and Dysport are what we call neuromodulators. They weaken the muscle response, okay? And so when you weaken that muscle response pulling down, it literally takes that smile, or it takes that frown. I got it wrong. Takes that frown. I'm gonna fire me. We take that frown and we turn it upside down.
Yes.
And so that's what we do. And usually, how many units do we treat that with when we use Dysport or Botox?
Not many. It's a very small amount, 15 of Botox or maybe 5 of Dysport, 5 or 10.
Right. So either 5 of Botox or maybe 15 units of Dysport. There is a 3-to-1 ratio. So it takes just a very small amount. And so it's something that we can do, and it should last you about 3 to 4 months. So that's a treatment that can be done 3 to 4 times a year, and it can again turn that frown, get it right, Dr. Tom, turn that frown upside down. So that's one of the things you can do. So you talked about that emotional side. Then you talked about, Karina, you mentioned appropriately so, people say, you know, it's these jowls, I feel them hanging down, or I feel like my face is dropping, or they may say my jawline doesn't look right. Okay, so I know that we talked about 3 patients, right?
Yes.
Without talking about their names, can you describe kind of their ages and, you know, who was presenting to our office, just sort of as a group? Can you tell us a little bit about who we just saw one of them right before we came out here.
Yeah, it was funny when I brought her back. She said, I thought I saw a video of him talking about contouring the jawline. Can we talk about that today? And I said, you know, we will talk about it at the radio show, and we will mention you, not by name.
Right, and so if you're listening, we'll call her Natasha. Hi, Natasha. See, we told you we were going to talk about you. All right.
Yeah.
So what was her complaint?
Really, she didn't necessarily complain to me about something, but she just saw that as an area. I want this treated. I want this. This is what she said to me. I heard that he does this. What can we do? Okay. And then we brought you in. So.
Right. And then we brought me in. Okay. So before we talk about what we did for her, can you name, what about some of the other patients?
Yeah, so...
By the way, that patient is a baby boomer, so she's in my age group, the aging baby boomer. And so how would you describe the other 2 patients?
Our other 2 patients are in their 50s. Okay. Ethnicity-wise, one is Vietnamese. Right. So a little bit of a rounder face. Right. And then I think she was primarily Caucasian. Was there a little
Northern European, right?
Northern European.
Beautiful Irish-looking gal, right?
Yeah,
beautiful Irish-looking gal.
So different faces, but same kind of... I see, you know, I think our Vietnamese patient I don't see as much of the angles. Not sure if her complaint or her concern was the hanging as much as the Northern European where she saw, I see this is, you know, this really bugs me.
That's right. And so for those on the radio, this is going to be on YouTube. So if you want to just tune into our YouTube show, we'll put it up hopefully later this evening. You can see the areas that Karina is pointing to. But what she was describing for the Vietnamese patient that we had, they both were just turning 50 or had just turned 50, so they are Gen Xers. Right. And she came in complaining of her face being rounder, and she wanted to have more contour to her face. And when you really got her to speak about what her concern was, it really was the jowls. Okay, so what are the jowls? If you, again, touch the side of your mouth and bring it down to just on the outside of your chin, it's that part of the skin or fleshy portion of the face that hangs over or hangs down beyond your jawline. And that's what we tend to call the jowls. So that was one of her concerns. And then our Northern European, mostly, I think, Irish, beautiful young lady as well. Her complaint was the jowls, but one of her concerns, she described it as being, it's around my mouth. I just don't like how my mouth looks. So those are kind of the complaints we're trying to share with our audiences who's come. Okay, so let's talk about how we approach that. Okay, so there's some generalities and then some specifics for each patient. So usually you hear me talk, and I know you're falling asleep in the corner of the room because I'm going over this over and over with each patient. But you know, what were the general guidelines, or what general kind of treatment plans did we recommend for these patients?
So after taking photographs and really reviewing, you really recommended filler, which is in the Restylane family, Define, for that jawline. And then Restylane Contour is what I saw you use as well, which is softer for the mouth area. So two different fillers for two different areas of treatment.
Right. So what Karina is describing about is we particularly using the Restylane line of fillers for these particular maneuvers. I'm using a thickerer filler, if you will. It has more substance for foundation support. And what we're trying to do is define the jawline. If you take where the jowl is and you go to the back towards your ear, so where your jowl is and back towards where your ear is, usually just above that area, you'll notice actually that your face looks deflated in that area. It appears that the weight of your face is in that jowl and the front part hanging down. So what we'll do is we'll freeze up the skin with a little local anesthesia, and then we take a long little blunt cannula tube and we through a tiny little hole, and we slide it along from that jowl area back towards the angle of our jaw towards our ear, And by doing that, adding volume in that area, it helps to further define the jawline, Karina, and it pulls the skin up as well, so it can actually make the neck look a little bit better. Usually takes about a syringe on each side, and what we use is a syringe filler type called Restylane Define. It's and basically it defines the jawline, and so that's what we will use. So we recommended that for our baby boomer patient that we just saw before the show. We recommended it for the actually for all three of the patients, and each one will require a different amount depending on the amount of aging of the face and the shape of the face. So that's something that we would do. So we would use Define, and I'll get to using the other type around the mouth, but was there anything else that we recommended for these patients?
Yes, enhancing that chin area.
Absolutely. So the chin area, and for those who are on the radio who didn't see, I was pointing at my chin when I asked Karina that question, but enhancing the chin area, which people don't think about. If you took a side photo of yourself, so you see the angle up by the ear of the jawline and you come forward to your chin, a lot of times as we age, our bone of our jawline resorbs, Karina, and so our chin becomes a little bit recessed, and it takes away from that nice angle of the jaw, and that definition. So we'll take Restylane Define, that same thickerer filler, if you will, and I'll inject it directly in the chin. And I have had that procedure done for myself. And the reason that I've had that done was the same reason I recommended it for our 50-year-old Vietnamese patient, was that we tend to, I'm 3/4 Chinese and 1/4 Greek, but we tend to have rounder faces, and so we're kind of looking for more angles, if you will. So adding that to volume to the chin more clearly defines our jawline, and so I've had it done for myself, and I really like that effect, and that's also what we had recommended for our baby boomer patient, and actually for both of the patients, even for our Northern European Irish patient, we did that for her, and when we got done with that, to her it was this big wow, oh my gosh, and her biggest complaint was around her mouth, but by adding that volume in the chin, it began to set up the foundation for her mouth to look prettier, and it diminishes the effect, believe it or not, of the jowls. It diminishes the effects of the jowls. So, so injecting that chin area. Do you have any experience with this yourself?
I do, yeah.
Okay, so why don't you share with the listening audience about this, Karina?
When I first started with you, my journey back 4 years ago.
A great 4 years for us.
Great 4 years for us. I wasn't too much into let's fix this or let's do that. But when we came around, I said, okay, so if you did, what would you do for me? What would you recommend? And definitely we did put Dysport in my chin to help relax that muscle, because I don't really frown, but but under the mask, I was frowning with my chin, apparently.
Right. So I'm going to interrupt you for a second there. So for those who may not know what we're talking about, there's a muscle on our chin as well, and that's called the mentalis muscle, okay? Like we're all mental, right? Okay. And for some people, they contract that muscle up, and sometimes it causes a horizontal line above your chin over time, or that your chin looks, some people say it looks all modelly or like a Sharpay, okay? I don't like it. And so it's because of that muscle contracting in the chin. And as Karina was deciding, oh, I'm going to play Karina. I got to tell you, I love Karina. You know, she's very happy with herself, but, you know, she's in the industry. Hey, I want to try a few little things. We all want to tweak a little something to make us feel more confident, right? And so I kind of studied you, and I think I surprised you. I said, you know, let's put a little bit of Botox or Dysport in your chin.
Right.
What was the effect when that happened for you? What did that do?
I definitely saw an improvement in my jawline.
Okay.
And just the way it looked from a side profile. And then I guess I never paid too much attention to that orangey peel look that I did get when I was, I don't know, concentrating or trying to express some sort of emotion. So just a relaxation and harmony around my mouth area.
So that, yes?
I just want to ask, because this sounds like two conflicting kinds of things. You can either add volume, right, with filler on the chin, or you relax the muscle. So would you do one or the other or both?
So it's a great question. However, actually they aren't conflicting, because when you inject the mentalis muscle, and you can't see me on the radio, but I'm just putting my finger on my chin, I'm pushing it up towards my lip, okay? So that's what this muscle does, is it shortens your jawline. So when you relax that muscle, it allows the chin to fall back down into its normal, when you were born, anatomic position, not that contracted up towards your lip. And so it actually extends your jawline as well as fillers. So great question that you led us into that. Thank you, Michelle. And that's what we did. So Karina had mentioned kind of in technical terms, you know, I noticed my jawline was more defined. I noticed I didn't realize my skin was kind of dimpled in my chin, but that was better. Understand that I could never tell, and this is dangerous, because I never could tell when Karina was mad at me, because she doesn't frown up here where most people frown. It's her chin, and we started working around COVID, so I couldn't tell when she was mad at me, okay? But when I was able to study this, Karina didn't relate to you, the listening audience, what was kind of her emotional thing, if she was going to change anything about herself. Do you remember that? Do you know what I'm going to say, Karina, or not sure?
Be more assertive? Is that what it was?
No, well, it goes along with that. I wanted Karina to be more assertive, absolutely. But what Karina was saying, and a lot of times you get that with people with rounder faces, what we call ethnic. Karina is your 100%, she's 100% Mexican, is that we have the rounder faces. Her concern was that everybody kept on telling her she looked like she was a kid. Okay, I would love to be told I would look like a kid. How about you, Michelle?
Yes.
Yeah, we would love it. Okay, but when you're 23, you know, you don't want to be told you look like a kid. And so I kind of was studying that, and part of that was sort of the roundness. So by softening this contracting muscle and letting it drop down, we gave her more definition. And I actually presented this at both the American Academy of Cosmetic Surgery meeting as well as the California Academy of Cosmetic Surgery. And Karina was very kind to let me use her photos. But what that did was it would help Karina to look more sophisticated, okay, and look less like a kid. And so that was kind of fun.
It was fun.
Achieving that for you, right? And so we went ahead and we relaxed her muscle, and then we decided to add a little filler, because we were kind of just playing with it, and why not, because it would go away over time. And so she took a chance and did it, and she loves it, right?
I do love it. Yeah, it looks great.
And so and I appreciate you sharing that with us.
Of course.
Karina. So that's super. So, we talked about definition of the jawline. So definition of the jawline is using a thicker filler and going from the jowls backwards to the angle of your ear. Okay, that helps to define the jaw. It actually pulls a little bit on the jowls a little bit backwards. It doesn't do what a facelift will do, but it will help to improve that for you, and it's subtle, very natural looking. Then we also can enhance the chin, which extends our jawline. And again, it's smoke and mirrors, shadows, okay, is that it will help to soften that jowl area as well. Then another part of what people don't understand, and we were discussing this actually with our Northern European patient who's 50-ish, our English-Irish, and then our baby boomer patient who's my age, and we talked about the fact that the volume around their mouth was beginning to recede. So it's where they feel like their mouth is dropping in. So if you're a listener and you say, oh, I have that concern, it feels like around your mouth, it's just involuting and dropping inside into your face. We see that a little bit more with Northern European types than we do with the rounder faced individuals, but I even see that on myself as an aging baby boomer. I've had filler in my chin, as I've mentioned, but I'm going to have what we recommend for both of these patients, and I'm going to have Mary, our lead nurse, inject me in those areas of concern to help to soften the jowl area on myself. But we use a filler called Restylane Contour. And so what it does is helps to contour the face, and it probably, of all the fillers, is softer like fat, okay? We've used other fillers in this area, but to me, that area can cannibalize filler a lot without getting much incremental improvement, and it can therefore then look heavy. And I don't like that look. I think it doesn't look natural. So we now use contour, which is softer, and we, again, using a cannula, and we go up, and if you were to go down, you know, in front of your jowls on your jawline and touch it, and then take your finger and go up to the side of your mouth, that's in front of the jowl now, okay, not in the jowl, but in front of it. I will go in that area where it is usually shadowed by the jowls. So when you look at each other and you see the light coming down on us, what we see is this area, and it looks darker right in front of your jowl. So by adding volume to that area, we put that skin and part of your structure of your mouth out further for the light to bounce on that area, and so it looks more homogeneous going from the jowls to the chin, and so it softens that area. And so I will use Restylane Contour to go up towards the side of the mouth, then I move slowly above that chin muscle. We're getting so technical now, you listeners are getting really smart, called the mentalis muscle. Remember that? We kind of go up around that mentalis muscle in that groove, and that will help to soften the jowls, and it gives you a really nice natural look. It's really a great beautifying tip. I love this technique of injecting contour in that area. What has been your thoughts when you see this done on our patients?
I definitely see that there are immediate results that these patients like. So the immediacy of it is helpful to them and their appearance and what they see in the mirror.
And so Karina brings up a good point. See, that's why I love having her on the show, because she's talking to the patients, and I go in and I think I try to get into my patient's head in terms of what do they want, what am I going to recommend for them, keep in mind their pocketbook, what are their expectations. And then after we get done talking, then they really tell Karina what they want, okay? I don't know why that happens, but they do. They talk to Karina, okay? And then she gets the real scoop on them. But that's what she's saying is true. They feel more confident, and they want an immediate result, okay? And so what's nice about filler is it's immediate, right? How long does it usually take for Botox and Dysport to kick in?
It can take up to a week,
You're absolutely correct. So I tell people 3 to 5 days, but it really can be up to a week. So if you have that mentalis muscle injected, or your frowns or the 11s injected, it could take anywhere from 3 to 7 days for that to fully kick in, right? But with filler, when do you see the results?
Right as we're done.
As soon as we're done.
Working, you get to see
everything
come together.
And I think that's why those of us who do filler injections, we love it so much, is because it's immediate effect, okay? There might be a little bit of swelling. Normally in the face, I don't feel that there's a lot of swelling, maybe 5% swelling. Injecting the lips, you probably get about a 10 to 15% where they're a little bit swollen, and then that will go down. But for the most part, injecting in the face, what we're talking about around the mouth, the jawline, I feel like filler is a great way to go, and what you see is what you get. If you're not somebody who bruises easily, you could do this, and the next day you're actually right out of the office, you look totally natural, carry on with your life. We might tell you not to go and work out, right afterwards, but just carry on and go back to work, whatever it is that you do. It's actually a great treatment for the jawline is the Restylane filler for the jawline, the chin, and around the mouth.
So I do have a question, because you're talking about smoke and mirrors and shadow and things like that. Can this all be enhanced with really good, technique when you're putting on your makeup? Because you can then like use bronzer or shading and things like that to enhance what you've done. Then,
I can't believe it. It's so funny. I know the listener goes, oh, he always says that. It's completely true. We pick a topic, and then all of a sudden, all these things sort of drop from the heavens, and what you're talking about, Michelle, is can you use concealer enhancement? And I want to hear from Karina what she does. Of course, she's only 27, so she doesn't have to do anything, but what she might recommend. I was puttering around. I needed to get off to the gym right away because I had an early morning meeting today, and up on social media. And when I get on Instagram, I tend to look at my colleagues and these different, instructional videos, educational videos that I'm watching. But they had one where a young lady was talking about putting concealer there. And her talk, remember I talked about putting contour around your mouth in front of the jowls, and it brings the tissues out, and so the light hits it and it lightens it because it's in the shadows. Exactly what she was talking about, using a lighter concealer in front of there. She was talking about the folds of the nasolabial folds in front of there, and the way she did it, and she helped to soften it. So you're absolutely right, Michelle. Right. Yeah. So you don't even, thanks, Michelle. Patients don't even need to come and see us now.
No. I'm
just go put on makeup.
Enhancing the work that you're doing, right? So
right. No, that's good. Yeah. It's all good. Okay. So anyway, so that's what you can do. How about any thoughts about that?
Yeah, I definitely think that makeup can help conceal and contour those areas, most definitely. Yeah.
So we only have about 30 seconds left, so I'm going to go through quickly. We're talking about treating the jowls. One, you can use Dysport or Botox on the mentalis muscle, the chin muscle, to drop it down. That softens the jowls. Taking filler around the mouth called Restylane Contour, and then using a stiffer filler called Restylane Define, go up and down the jawline to help to better define it.
Excellent. All right. Be sure to call Dr. Tom for a free consultation. Visit his website at drtomcosmetic.com or call 707-542-8346. This is KSRO.